Florida is about to become the first state in the nation to completely eliminate all vaccine mandates for schools. Governor Ron DeSantis announced this sweeping move on Wednesday, declaring that his administration, in coordination with state health officials, will end every single school vaccine requirement. Florida Surgeon General Joseph Ladapo described vaccine mandates as a form of control, comparing them to slavery, and told Floridians that the state will no longer decide what they or their children must put into their bodies. For decades, Florida, like every other state in the country, has required children to receive a set of vaccines in order to attend public or private schools. These vaccines, which protect against life-threatening illnesses such as measles, mumps, rubella, polio, tetanus, and hepatitis B, have long been recognized as essential to preventing outbreaks. Exemptions for medical and religious reasons already existed, but the new policy would remove all requirements altogether. This announcement is being tied to a broader national health agenda supported by Health and Human Services Secretary Robert F. Kennedy Jr., called Make America Healthy Again. The movement promotes ideas such as medical freedom, informed consent, and expanded parental rights. However, experts have expressed serious concerns, noting Kennedy's history of spreading health conspiracy theories, including the false belief that vaccines cause autism. Since taking office, Kennedy has removed members of the CDC's Vaccine Advisory Board, brought on fellow vaccine skeptics, limited public health communication, and canceled studies on mRNA vaccines. Florida officials argue that the changes empower parents and individuals, while critics warn of dangerous consequences. Every state currently has vaccine requirements to keep preventable diseases under control. Research spanning decades shows these laws have drastically reduced disease outbreaks among school-aged children. Without them, experts fear immunization rates will fall sharply, creating conditions for fast-spreading epidemics. The Centers for Disease Control and Prevention estimates that childhood vaccines save more than 4 million lives globally each year. Recent history shows the dangers. Last year, more than 760 people were infected with measles in West Texas, where vaccination rates had dropped well below the level needed for herd immunity. 2 unvaccinated children tragically died in that outbreak. Florida itself has seen a decline in childhood immunizations, falling from over 93% in 2020 to under 90% in 2024. Health officials say herd immunity requires about 93% coverage. When the rate dropped in 2018, the state saw an immediate rise in measles cases. Public health advocates in Florida are calling this move reckless. Representative Anna Escamani, a Democrat, warned that ending vaccine mandates will trigger a public health disaster by lowering immunization rates and putting children, seniors, and vulnerable communities in danger. The future of Florida's public health is now at a critical turning point. As the nation watches, the decision raises serious questions about freedom, responsibility, and the balance between individual choice and collective safety. If you found this breakdown informative, please don't forget to subscribe to InsightPulse and turn on notifications so you never miss an important update. Your support helps us continue bringing you fact-based reporting on stories that truly matter.